How I plan breast cancer surgery, bringing together art and science. Surgery is often thought of as a purely technical skill, but in breast cancer surgery, it is also deeply artistic. Hello, my name is Rajiv Dave, and I'm an oncoplastic breast surgeon. And in this video, I want to take you inside my thought process and show you how I plan breast cancer surgery. Every operation I perform has two goals: remove the cancer safely and preserve, restore or improve the shape and volume of the breast. Achieving both requires a balance of science, anatomy and artistry. There is a well-recognized framework called BFACE, which helps surgeons assess breast aesthetics. It looks at breast shape, footprint, areola, contour, and envelope. And this provides a structured way of analyzing the breast from an aesthetic perspective. Please see the link below for further information about this framework. But in cancer surgery, we need to go one step further. We are not just analyzing the breast, but we are reconstructing it in real time in our heads. So over time, I developed my own way of planning surgery, a structured approach that I use for every patient. For this, I use a mnemonic: let's visualize the surgical result. The first step is identifying the key landmarks, starting with the ideal nipple position, known as the breast meridian. The lower fold of the breast, known as the inframammary fold. The midline of the breast, the lateral border of the breast. And these define the natural architecture of the breast. If you lose orientation here, everything else becomes more difficult. Step 2, I assess how the volume of breast tissue is distributed. Is the breast fuller at the bottom and empty at the top? Is it fuller outer compared to inner? Is it symmetrical or asymmetrical? Because when we remove tissue, we must understand how that will affect the overall shape of the breast. Now we map out the tumour. Not just where it is, but how much tissue needs to be removed from around it. And this is critical because cancer surgery is not just removing the lump, it's removing a three-dimensional volume of tissue, which includes the cancer and a margin of normal tissue around it. Now we move to one of the most important steps: planning the skin excision and preserving the blood supply to the nipple. This is what we call the pedicle. A pedicle is simply the tissue that carries blood to the nipple. Choosing the right pedicle is essential because it determines safety, healing, and final appearance. Finally, we plan how to reshape the breast. And this can involve volume displacement, so this is rearranging existing breast tissue, or volume replacement, which is bringing tissue in from nearby areas such as the outer chest wall or lower to the breast. And this is where surgery becomes truly artistic, because we are not just removing, we are sculpting. When all of these steps come together, the cancer is removed and the breast is reshaped, and the patient can move forward with both physical and psychological recovery supported. This structured approach allows for oncological safety, predictable aesthetic outcomes, and reproducibility across different breast types. It transforms surgery from a reactive process into a planned, deliberate reconstruction. For patients, this is not just about removing cancer. It's about identity, confidence, and feeling whole again. And that is why breast cancer surgery is not just a science, it's an art.